Hi, my name is Rod Blanchard. I am the founder of The Other Healthcare. We specialize in helping small businesses, those with fewer than 50 employees, maximize the tools, services, and solutions that they offer their employees for healthcare. And we do it in a way that saves both the employer and the employee a pretty good chunk of change. Now, our solutions aren't for everyone, but if you have a small group health plan, this message is for you. We have an 80-20 plan, a plan that lowers your monthly premiums by 20% and lowers out-of-pocket expenses by 80%. You heard me right. If we can't lower your monthly premiums by at least 20%, and when you have a major medical issue, lower those out-of-pocket medical expenses by at least 80%, then we don't want to waste your time or ours. Since you're watching this video, I assume that you're offering a healthcare plan to your employees. You offer the health plan because you care for your employees. It lifts morale, increases employee loyalty and retention. It's even a tax write-off. It's expensive, and you don't have to do it. But you do because you feel like you're providing genuine value to your employees. But are you really getting the most bang for your buck? Let's look at a small business with 20 employees. This employer really wants to take care of his employees, so he provides them with a Cadillac Gold plan. This plan features a $500 deductible for medical benefits and a $0 deductible for prescriptions. It's an 80-20 plan with a copay of $30 to see a primary care doctor and just $50 to see a specialist. There is an out-of-pocket maximum of $7,700 for an individual and $15,400 for a family. This sounds like a wonderful plan. The employees are thrilled. 11 of the 20 employees sign up. Those that don't either have coverage through their spouse or maybe they're working part-time so they don't qualify for benefits. The owner of ABC Enterprises pays 100% of the employee's premiums. If the employee wants to include his spouse or dependents on the plan, they can take care of that through a payroll deduction. The owner feels like he's being generous. After all, he's paying more than what the ACA requires. Of course, when we take a closer look, the single employees are paying 0%, while those with families are paying as much as 22.5%. The average cost to his employees to cover their entire family is just 11% of their monthly income. Some might question the fairness of the plan, but it's easy to manage and costs the owner a palatable $5,379 a month. His employees kick in $6,768 for a total monthly premium of $12,105. Now let's take a look at this plan in action. We're going to look at employee Karen Anderson and see how this plan helped her with her medical benefits over the course of the year. They've had a pretty good year health-wise, except for her son's snowboarding accident. He was flying through a terrain park, lost control, and came down on a rail, breaking his femur. Here's how her Gold plan performed. You first need to take into account that between her and her employer, $11,220 will be paid in annual healthcare premiums. That's $935 per month. The initial doctor visit and x-ray she paid for out of pocket because she hadn't reached her deductible. Trevor had a complex fracture that was going to require surgery. At the hospital, Karen quickly reached her deductible. From that point, she only needed to pay her 20% coinsurance. The total medical bills came to $10,084. The insurance company paid $7,660, and Karen was left with a bill of $2,423. So over the course of the year, she paid $13,643 in premiums and medical bills. And her insurance company is good enough to pay her back $7,660. But it gets worse. Karen is a single mom on a tight budget, so she pays her medical bills with her credit card at 18% interest. Her budget only allows her to pay $50 a month, so it will take her 88 months to pay off these medical bills, and she will spend another $1,938 on interest. Ouch! Now let's see what would happen if she had a high-performance plan designed by The Other Healthcare. First of all, her annual premium drops to $6,657, which is a 41% savings. You would think that with that much savings, her medical coverage would have to suffer, but just the opposite is true. Look at this. Her primary health care would pay less for the injury, just $4,929 compared to $7,660. But when you add the annual premium, you have an $1,800 savings. But here's the key to a high-performance plan. Since the Affordable Care Act subsidizes a large portion of her monthly premium, we take a portion of those savings and purchase supplemental insurance and fund a health savings account. Those are all included in the $6,657 premium. Her supplements pay her no strings attached a check of $9,250. Plus, she has $2,400 set aside in her HSA account. The $9,250 easily covers her out-of-pocket expenses of $5,155 on the broken leg, and she has over $3,000 left over. That's money she can put in her pocket in a savings account, or take her kids to Disneyland. Of course, you may want to wait till Trevor gets his leg out of the cast. Karen's annual net healthcare expenses for the year with the Other Healthcare's high-performance strategy is just $162, compared to the Cadillac Gold Plan's $13,644. Her high-performance plan also includes dental and vision coverage that she took full advantage of, as well as critical illness, life insurance, and short-term disability benefits that she didn't need this year, but she has the peace of mind knowing that she is protected if there was a need. Remember our 80-20 objective: 80% lower out-of-pocket expenses and 20% lower premiums. So for Karen, we delivered 99% lower out-of-pocket expenses and 41% lower monthly premiums. So which plan was best for Karen? Well, business owners always tell me, yeah, that's probably going to work on a broken leg or something like that, but what if there were a major medical issue like cancer to deal with? Well, let's look at another scenario. Fred Benson is one of the owners of the company. He has 5 children. He makes $150,000 a year, and when he goes in for his routine colonoscopy, they discovered a growth in his colon. When they did a biopsy on the tissue, he was diagnosed with stage 2 colon cancer. His world turned upside down. Fred has a battle on his hands, not to mention a host of medical bills. But the cost of dealing with cancer goes far beyond just medical bills. There's lost work. There's travel expenses associated with medical treatments. There's an urgency to life, so there are things on his bucket list that he wants to get checked off. And really, beyond anything else, he just wants to spend time with family and friends. So let's take a look at these medical plans and see how they really help Fred out in this difficult time. First, we'll take a look at the Cadillac Gold Plan. With his large family, his annual premiums are not cheap. $30,996. With his cancer diagnosis, he quickly hits his out-of-pocket max of $7,700, and insurance plan takes over from there. Over the course of his cancer treatment, the Gold Plan pays out a generous $110,900. His net medical expenses for the year, $38,696. Now let's take a look at a high-performance plan designed by the Other Healthcare. Now remember, our goal is to always lower out-of-pocket expenses by at least 80% and lower those monthly premiums by at least 20%. First of all, you'll notice that annual premiums drop from $30,996 to $18,288. That alone is a 41% savings, but remember, the premiums include major medical, a supplemental accident plan, critical illness, short-term disability, dental coverage, vision coverage, a hospital indemnity plan, and in his case, a fully funded HSA account. Now let's take a look at how all these plans combine to really take care of Fred's medical and personal needs. His high deductible plan has a lower out-of-pocket max, so it actually pays out nearly $1,000 more than the Gold Plan. Now take a look at what happens when his supplemental insurance kicks in. His critical illness policy pays him $50,000. His hospital and short-term disability add another $10,750. And he has added $7,000 to his HSA account that he won't even have to touch. His net medical expenses for the year were a plus $42,172. Now let me reiterate. After all of his medical expenses were paid and his monthly premiums were paid for the entire year, he was able to pocket $42,172. That is a 210% improvement over the quote, Cadillac Gold Plan. Now that's how a health plan can and should work. Now just a few housekeeping items before we wrap up this video. These are the requirements for us to implement a high-performance 80/20 healthcare plan. You must have a group healthcare plan. You must have fewer than 50 full-time equivalent employees. The process takes some time. You should plan on about 2 months. Supplements have underwriting restrictions, so they cannot be added after symptoms arise. You can implement this plan now. You don't have to wait until your annual enrollment period comes back around. Of course, if you have employees that have already reached their deductible and your healthcare plan is finally paying some benefits, you don't want to introduce a new plan that's going to cause all those deductibles to reset. But you need to give us a call so we can get you on our calendar. So here's my final instructions. Call me. My number is 801-859-3456. Give me a call. We'll get to work designing a plan, especially for you and your employees. Thanks for your time.